Hello everyone, today we're going to talk about the anatomy of the male's reproductive system. If we look at this sagittal view of the reproductive organs of the male, anteriorly there is the urethral orifice, which basically means the urethral opening. Through that opening, urine can come out and semen can also come out. Semen is a mixture of sperm and fluids. Those fluids are mainly produced by accessory organs. Those accessory organs are the seminal vesicle gland, the prostate gland, and the bulbourethral gland. The bulbourethral gland is homologous to the greater vestibular glands in females. It produces mucus during sexual intercourse to help lubricate the penis. The head of the penis right here is known as the glans, and there is a foreskin on it known as the prepuce. That's the foreskin that gets removed during circumcision. Research has found that by the removal of this foreskin, there's a 60% reduction in the risk of acquiring the HIV virus or any other infections. The penis, it's made up of erectile tissue, and we are going to zoom in on it and talk about it. This is right here. This right here is the urethra, and so the urethra in males, it's pretty longer compared to the urethra in females. We divide it into three parts. There is the prostatic urethra, there is this intermediate part, or sometimes they refer to it as the membranous urethra, and then there is the penile urethra right here. Outside of the male's body, there is the scrotum. Inside of the scrotum, there is the testes. This is where sperm is going to be produced. This is also where testosterone hormone is going to be produced. Males continuously produce sperm every day. The sperm that's going to be produced by the testes goes and gets stored right here in this region known as the epididymis. This is where it can get stored, and it can get stored for actually a few months, and this is where it's going to start becoming mature. If ejaculation is to take place, then the sperm leaves the epididymis and travels down the ductus deferens or the vas deferens. And you can see that the vas deferens goes all the way around the urinary bladder, and then as the ductus deferens makes its way around the bladder, it gets into contact with a duct coming out from the seminal vesicle. So the sperm starts getting mixed in with the fluids that are coming out or being secreted by the seminal vesicle gland. And when the ductus deferens merges in with the duct that's coming out from the seminal vesicle, we start calling it the ejaculatory duct. Once the ejaculatory duct merges in, as you can see right here, with the urethra, we start calling it the urethra. So now you're going to have the sperm mixed in with fluids secreted by the seminal vesicle and fluids secreted by the prostate. And then as it comes down, the sperm is also going to be mixed in with fluids produced by the bulbourethral gland. So we start calling it the semen because now it's a mixture of sperm and fluids, and so that semen is going to make its way down the penile urethra, and it's going to be ejaculated out through the urethral orifice. The scrotum is a sac of skin and superficial fascia. That superficial fascia is made out of connective tissue. That scrotum is located outside of the body, outside of the abdominal cavity, and it's covered with some hair right there on the outside. Inside of the scrotal sac, there are the testes. Now, the testes, this is where the sperm is going to be produced. This is also where testosterone is going to be produced. Having the scrotum and the testes outside of the abdominal cavity provides a temperature that's about 3 degrees lower compared to the inner temperature inside of the body. And that prevents the sperm from dying, because the sperm is not going to be able to withstand the temperature inside of the body. And actually, when the temperature outside of the body is either cold or hot, the testes, so when it's cold, the testes are going to actually be pulled closer to the body wall, so that it can get some of the body heat, and the skin of the scrotum is going to be heavily wrinkled, so that it can prevent any heat loss. When the temperature is pretty hot, the scrotum is actually going to hang lower and away from the body trunk. And the skin is going to loosen up so that it can cool off the testes. The Dardis muscle right here within the superficial fascia of the scrotum, this Dardis muscle, it's a smooth muscle, and it helps wrinkle the scrotal skin, especially, as I said, when it's cold, the scrotal skin would wrinkle so that it can trap the heat and prevent heat loss. The cremaster muscle, it's a muscle right here that arises from the internal abdominal muscle, and it helps elevate the testes. There is testicular arteries that are going to supply the testes with blood, and testicular veins that are actually going to drain the testes. Now, the testicular veins, as you can see, they actually form a network right here, and we call it the pampinephrum venous plexus. It's a network of veins that kind of look like a web right there, and those pampinephrum venous plexus, it's found on top of the testicular artery. Now, the reason why it's found on top of it is that the testicular artery brings warm blood to the testes. That warm blood, if it reaches the testes, can actually kill the sperm. So having that pampinephrum venous plexus, which carries much cooler blood, can actually trap the heat and absorb the heat out of the testicular artery before the blood reaches the testes. So the pampinephrum plexus helps cool down the blood before it enters the testes. So it can keep the testes at a cool temperature. Right here, the spermatic cord, this is where you would have the testicular artery, the testicular veins, the pampinephrum plexus, and you will also have nerves. When when a male gets hit, so if their testes gets hit, that can cause severe pain, and they can get nauseated. Within the testes, there are these tubules right here known as the seminiferous tubules. This is where sperm is going to be produced. When the sperm is produced within those tubules, you can see that those tubules are merging right here and conveying into those straight tubules. So the sperm make their way into the straight tubules. From there, they're going to make their way into the rete testes, and then from there, they're going to make their way into the epididymis. The epididymis is going to store the sperm. The sperm can actually be stored in the epididymis for months. The sperm that's made is immature. So once it's in the epididymis, it's going to go ahead and start becoming a mature sperm. And as I said, it can be stored there for months. If no ejaculation takes place, then the sperm is going to die. It's actually going to break down. It's going to be phagocytized by the cells of the epididymis. No worries, because males continuously produce sperm every day. Now, if ejaculation is to take place, then the sperm is going to make its way out of the epididymis, and it's going to travel down the ductus deferens or the vas deferens. The vas deferens consists of pseudostratified epithelium tissue. It also contains smooth muscles, and those smooth muscles are going to contract, propelling the sperm down the vas deferens until it reaches the urethra, so it could be propelled outside of the body. A type of a birth control method out there for males is to have a vasectomy. The vasectomy procedure is a procedure where the ductus deferens gets tied off. When it gets tied off, it basically, it's not going to allow any sperm to be ejaculated out. But if someone does have a vasectomy, they are still going to release an ejaculate. It's just that this ejaculate is not going to have sperm inside of it or within it. The ejaculate is just going to consist of the secretions produced by mostly the accessory glands. The vasectomy procedure could be reversed if someone changes their mind and wishes to have a child. Once the sperm is produced in the testes, as we said, the sperm is going to make its way into the epididymis, where it can get stored if ejaculation is to take place. It's going to leave the epididymis and travel down the ductus deferens. You can see the ductus deferens making its way right here, where it's going to meet up with the seminal vesicle gland, and right here where the ductus deferens merges in with the seminal vesicle, we start calling it the ejaculatory duct, but not for long, because once the ejaculatory duct meets up with the urethra and within the prostate, we start calling it the prostatic urethra. And then right here is going to be the intermedius or the membranous urethra, and then this is going to be the penile urethra. And eventually the semen is going to be ejaculated out through the urethral orifice. The seminal vesicle gland, the prostate gland, and the bulbourethral, those are the accessory glands that will help produce the fluids that's going to be part of the semen. So those seminal vesicle glands, for example, produce an alkaline, a basic type of fluid, which is going to contain sugar to give energy to the sperm, because it's going to have a journey to make its way into the female's reproductive organ, the vagina. It also contains a bunch of enzymes and substrates that would actually increase the sperm motility. The prostate also produces fluids that would increase the sperm motility, and it will also contain nutrients. And the bulbourethral gland produces mucus to help lubricate penis during intercourse. The semen that would come out, it's a milky white mixture of both sperm and all of the fluids that are produced by those accessory glands. About 2 to 5 mils of semen gets ejaculated, and it could contain anywhere from 20 to 150 million sperm per mil. Within the semen, there are hormones and enzymes that can actually increase the sperm motility. There are chemicals that are going to suppress the immune response within the female's reproductive tract, so it won't attack the sperm. There are some antibiotic chemicals that will actually destroy the bacteria, preventing the sperm from dying as it travels into the female's vagina, there are actually clotting factors that are going to be released in the semen, and those clotting factors are actually going to help the sperm stick to the walls of the vagina. So that again, it's going to try to make its way to the fallopian tube, so it wants to stick to the wall of the vagina. The semen is an alkaline, which means a basic fluid, and the semen being alkaline is actually going to help neutralize the acidic environment within the male's urethra, because as we said, urine also comes down the urethra, and urine is acidic. So if you have some remnants of urine sticking on the walls of the urethra and the sperm comes down, the acidity of the urine is actually going to kill the sperm. So the semen being alkaline is actually going to neutralize the acidity of the urethra. And also, as we said, the condition inside of the female's vagina is also acidic. So that alkaline semen is also going to help neutralize the acidic environment of the female's vagina. You can also see right here the penis. It's made up of erectile tissue. So there is the corpus spongiosum, which is right here on the inside, and then this part right here is known as the corpora cavernosa. They contain blood vessels, and so during sexual intercourse, those blood vessels are going to be engorged with blood. And so causing the penis to erect, and the blood is going to cause the penis to erect because it's not going to be drained, because the venous supply or the veins are going to be constricted, preventing the blood from returning back, maintaining the erection for a while. The corpus spongiosum actually right here helps keep the urethra open to allow, again, the ejaculate to be released out of the body. And so right here, we already talked about it. This is the head of the penis, the glands, and the prepuce, which is the skin that will get removed during circumcision.